I am Dr. B.K. Swain, Bijoy Kumar Swain, basically physician and a diverticulogist working as a physician in a multinational hospital at Cuttack, Odisha. Well, doctors or well listeners, let me start my topic first. It is a case study, case poorly controlled diabetic woman with genital tract infection. That means the lady whose sugar is not controlled properly, they used to develop genital tract infection as a side effect. This is the topic. So let me tell about the age, clinical criteria, and his and her, the sugar and H1s. A 68-year-old woman returns to your clinic for a follow-up visit 3 months after initiation of empagliflozin 10 milligram per day for her type 2 diabetic mellitus. That means empagliflozin is a SGLT inhibitor group and dose is 10 milligram. Her glucose levels have improved, no doubt, but she complains of vaginal pruritus and is worried that she has a yeast infection. Although her glucose has improved, but still she developed another side effect, another problem, that is vaginal pruritus. Then diagnosed pulmonary candidiasis in this patient and prescribed a single dose of fluconazole 150 milligram. That means the doctor diagnosed or I diagnosed a case of vaginal candidiasis, that is a fungal infection in this patient. And we have prescribed the fluconazole, the antifungal agent, 150 milligram per day for 10 days. After reviewing her laboratory test results, we noticed that since starting the empagliflozin, our H1's level definitely has improved slightly, that is from 8.9% to 8.2%, but it is still not where it needs to be. Our eGFR, that is the estimated glomerular filtration rate, is 69 ml per minute per 1.73 square meter. That means she definitely, her glucose has glucose increased and decreased definitely. H1C is decreased and her H1C decreased from 8.9% to 8.2%. That is only 0.6%. But her eGFR is almost normal. It has not decreased. So after getting that empagliflozin for 10 mg, definitely sugar has been decreased, number one. Number two, she developed a side effect of vulvovaginitis for which she has taken fluconazole 150 milligram. So let us come to the point. Sodium glucose 2 transporter 2 inhibitor, that is SGLT2 inhibitor, are increasingly important oral medication class in type 2 diabetes to type 3, with their use climbing dramatically in recent years. They result in a broadly similar amount of glucose lowering compared with the other oral agents, but can also reduce blood pressure and result in modest weight loss. That means, apart from these SGLT inhibitors, apart from the glycemic effect, it has got a non-glycemic effect, that is reduction of weight, reduction of systolic blood pressure, and reduction of cholesterol. In addition to the glucose lowering effect, large-scale clinical trials have demonstrated reduction in cardiovascular and renal outcomes in a high-risk group type 2 diabetes, as well as benefiting patients with heart failure, whether or not they have type 2 diabetes. Even if the patient is not, that means even if the patient is not suffering from type 2 diabetes, and having this heart failure, it definitely has a favorable effect. SGLT inhibitor. SGLT inhibitor reduce hyperglycemia in people with diabetes by increasing urinary excretion of glucose. Okay, this is the mode of action. This induced glycosuria increases the risk of genital infection 16, and both clinical trial and observational studies demonstrate 2.5 to 6-fold increase in genital infection in people using SGLT inhibitor compared with the control. That means the person who is taking SGLT inhibitor, they develop, apart from reduction of this glucose, they develop 2.5 to 6-fold of increase of genital infection in comparison with the control. So the development of genital mycotic infection is more common with SGLT inhibitors that is overall incidence in clinical trial of 4.6% compared to other oral hypoglycemic agents. If the patient develop, we can dissuade the patient for taking this, in fact, taking these SGLT inhibitors. So, a number of factors have been shown to be associated with the risk of genital infection in general population, in particular female sex and diabetes, especially when glycemic control is poor. The combination of SGLT inhibitors and DPP-4 inhibitor offers a suitable component in strategy to achieve target H1C without increased risk of hypoglycemia and weight gain with improvement in overall lipid profile. That means, which I have told later previously, apart from this glycemic effect, it has got a reduction of weight, number one. That is less risk of hypoglycemia, and that's a reduction of dyslipidemia. So reduction in the incidence of genital infection associated with SGLT2 inhibitor has been reported when DPP-4 inhibitor is added. Perhaps because of a better glucose control, although other possible mechanisms remains to be investigated. So if a combination of empagliflozin plus any gliptin, particularly DPP inhibitor, is added to the molecule, it will definitely have a better glucose control, with although other possible mechanisms remains to be investigated. So in clinical practice, the risk of genitourinary tract infection may be a barrier in preventing patients from receiving or continuing a potential life-saving therapy. In addition to local hygiene consultation on how to prevent GUTI, that is genitourinary tract infection, identify combination therapy that limits the risk of such AE is an interesting strategy. So what should be strategy? Either you have to reduce the dose or change the drug, or you have to take genital sanitation, which is very important for prevention of this mycotic infection. So the putative mechanism whereby DPP-4 inhibitor may moderate SGLT associated with genitourinary tract infection is deserves some comments. By far, the most straightforward explanation is that DPP-4 inhibitor plus SGLT inhibitor or stroke SGLT inhibitor combination reduced glycemia and glycosuria more than SGLT alone, thereby resulting in protection from genitourinary tract infection. So DPP-4 inhibitor activity is present within some yeasts, molds, and bacteria, and its inhibition may directly modify microorganismal function. So these highly speculative and sophisticated hypotheses need to be tested experimentally. That evidence has still there under investigation. That means the overall substance of my talk is that empagliflozin definitely the glucose lowering agent, SGLT inhibitor, and it has got side effect of urinary infection, particularly mycoplasma. If DPP-4 inhibitor is added to the empagliflozin or SGLT inhibitor, definitely the two are combined. Apart from this glycemic control, they have got also reduction of blood pressure, reduction of weight, and reduction of dyslipidemia. And the addition of this DPP under investigation, that it has got some molds or bacteria, and its inhibition may directly modify microorganism infection. So the patient has to take sanitation, particularly urogenital proper sanitation, and they should add DPP-4 inhibitor, which has got some antimicrobial effects. So these are the speculative and sophisticated hypotheses need to be tested experimentally. Okay, thank you.